I'm Craig Lederhouse. Thanks for listening to the Afternoon Edition, weekdays from 4 to 6 on CBC Radio 1 in Saskatchewan. As we've already been discussing on our show today, a new study by Canadian researchers shows that narrow veins are an unlikely cause for multiple sclerosis. This report has been called a death knell for the hypothesis which led many to believe in a controversial treatment known as liberation therapy. Thousands of Canadians have gone abroad for the treatment involving the dilation of narrow neck veins. Among them was Saskatchewan's Michelle Walsh, and she joins me now. Hi, Michelle.
Hi.
Michelle, what's your first reaction to this report today?
You know what? I wasn't surprised knowing that this study was headed up by one of our most negative neurologists in this province, and she's been wanting to disprove this since the beginning, so I wasn't shocked that this came out today.
There are others here, though, that went into it with quite high hopes that it might prove a connection, and were surprised to see that it didn't. She wasn't alone, is what I'm suggesting.
Yeah, no, fair enough. But you know what? I would really like to help educate your listeners. The narrowing is a generic term that was used by the Canadian TV to understand the concept of CCSVI when this first started 3 years ago. And already many studies with MRV, which is magnetic resonance venography, they've shown the sectional areas and the diameter of these veins with CCSVI are not different from the healthy ones, but the stenosis of CCSVI, clarified by dozens of studies, are not due to a narrowing of the wall, but rather to the presence of an intraluminal obstacle and external compressions. There's so many levels of this that is being expanded on amongst the world, amongst all the endovascular specialists all around the world, except Canada. In Canada, we have a neurologist heading up the Pan-Canadian trials. That's like asking your electrician to come and fix your plumbing problem. I mean, seriously.
Well, this isn't the first study, though, to suggest that narrowing of neck veins does not cause MS. There was one just a couple of months ago out of McMaster. It was led by a respirologist, somebody familiar with pulmonary systems.
Okay,
and it came to the same conclusion,
fair
correct?
Enough. Yeah, fair enough. But if you actually research his background, it's in pharmacology.
It is?
There's a lot of money to be made off of MS patients on these drugs that do not work.
So,
There's a lot of money. And you know what it comes down to is, I don't care if you find this an MS or not, but you know what? I felt better, and I'm still 3 years post my first procedure. I still feel better. I still have no progression with my multiple sclerosis. I've had no flare-ups. I've been on no drugs that the province has had to pay for, and I've gone abroad for this procedure and cashed into my retirement savings, and I'm sure glad I did, because we don't have time with this neurodegenerative disease to wait, like Dr. Trablusi said today. Oh, sit back and wait. Are you kidding me? Do you live with this disease? No, you don't. You don't have time to sit back and wait.
Well, let's talk about that, because the jury is still out on what this treatment does, the effect of the treatment itself. And that was made clear by today's research, the results as well. And we spoke to Tom McIntosh a little earlier today. He works with it's a sort of a policy analysis place which talks about public health and decisions being made into medical research. I just want you to have a listen to what he had to say about that notion.
Personally, I agreed with the decision of the government of Saskatchewan to help fund some of this research. I think it was important to do, but we have to stick with what the evidence is telling us, and that we shouldn't hold out false hope to people, and that while it was not a large amount of money that went into this study, it is in fact money that would now be better spent pursuing what other research options are out there.
Is it time to move on from this particular therapy and invest in other possibilities?
No, because you know what, Craig? This vascular connection with not only multiple sclerosis, but Parkinson's and brain traumatic injury, they're finding this in many other neurodegenerative diseases. And no, we're not dropping this. I'm sorry, but we're not giving it up just because, the teams that have produced a negative. If you sit back and call a spade, the negative reports are coming from the neurologists who know nothing about a vascular condition, and the positive reports are coming from the endovascular specialists across the world. So, you know what? There's been over a dozen positives. You don't see that in the news. You guys don't tell that side of the story. You just sensationalize all these negative ones. And you know what? The research is mounting around the world that this is tying into so many other diseases.
One of the other things that always comes up is that nobody's been able to reproduce Dr. Zamboni's results yet.
You know what? Fair enough. And you know what? I think actually there's even more to what Zamboni initially did propose in his result, which is why I think CCSVI should not be tied to MS. We need to look at it as it's a separate condition. and it's a totally separate thing. It has a lot to do now. The researchers abroad, even neurosurgeons, are finding blockages of veins in the brain. And so, you know what, that has a lot to do with how everything flows down from the brain and affects. But you know what, bottom line, as a patient, I don't care what you want to call it or who wants to naysay it. All I know is this made me feel damn better. It changed the quality of my life. I'm now a mother to my 3 young children. I actually just had a new baby last December. I wouldn't have been able to do that before. My days now have just changed so much, and I'm so thankful every day that I still feel this good. Because if I had not taken that leap of faith, I would be in that wheelchair that they fitted me for before I went abroad.
Michelle, the studies continue now, and the health minister referred to this. Funding will continue, or perhaps continue. Let me be clear. What we know is the study will continue to try and determine what effects the treatment has, to try and explain, for example, what you experienced, positive results from this treatment. They are still looking at this. It's another 2 years before they come to that conclusion. And the researchers are suggesting it could be anywhere between a very limited reaction or even just a placebo effect. If the result of that study suggests it's a placebo effect, what will your reaction be?
Yeah, you know what? I commend the health minister for wanting to further this research and getting answers for our patients, because we deserve that as patients. There's been thousands of us that have been abroad, not only from Canada, but, locally from Saskatchewan. And you know what? It's been 2/3 of us that have been benefiting. At first, I didn't even know what placebo was. But you know what? I didn't care because I felt better. But now, my neurologists, who maybe were skeptical at first, are following me with detailed MRIs. They're seeing my lesions are not active in my brain. They're seeing that some of my lesions are actually gone away and getting smaller. That's not placebo. I stand up and I don't pee my pants anymore. I mean, are you kidding me? If I could fake that, I'm a pretty good actress, but I don't. That's not placebo.
Michelle, thanks for talking to me about this today. I appreciate your time.
Thank you.
Bye-bye.
Bye.
That's Michelle Walsh. She is an MS patient, a strong advocate for neck vein therapy, and we reached her in Saskatoon.